Most people know what foods to should eat for strong bones. Anything chock full of bone-building calcium and its osteoporosis-fighting partner, vitamin D. Just as important, but less often discussed, are the foods and beverages that take away from bone health. From overly salty snacks to high in sugar sodas, certain foods can inhibit your body from absorbing calcium, reduce bone mineral density, and more. Beware of these foods that are bad for your bones. First, we will talk about high-sodium foods. When it comes to bone health, it's important to focus on foods that are high in nutrients like calcium, vitamin D, magnesium, and phosphorus. However, high-sodium foods are generally not recommended for bone health because excessive sodium intake can lead to the loss of calcium through urine, which can weaken bones over time. It's best to focus on a balanced diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and dairy products or non-dairy alternatives that are fortified with calcium and vitamin D. Second, we will talk about sugary snacks. When it comes to bone health, it's important to focus on foods that provide key nutrients like calcium, vitamin D, magnesium, and potassium. While sugary snacks are not typically considered beneficial for bone health due to their lack of essential nutrients and potential negative impact on overall health, there are ways to incorporate healthier, bone-friendly options that satisfy a sweet craving. And point number 3 is soda. Soda, especially when it contains high levels of phosphoric acid and caffeine, can potentially have negative effects on bone health. These ingredients can interfere with calcium absorption, which is crucial for maintaining strong bones. Additionally, regular consumption of soda has been associated with lower bone mineral density, which could increase the risk of fractures and osteoporosis over time. If you're looking to support bone health, it's generally recommended to limit your intake of soda and focus on consuming a balanced diet rich in calcium, vitamin D, magnesium, and other nutrients that promote bone health. Regular physical activity and maintaining a healthy body weight also play important roles in keeping your bones strong. In point number 4, there is caffeine. Caffeine is a topic of interest when it comes to bone health. Some studies suggest that high caffeine intake may decrease calcium absorption, which could potentially lead to reduced bone density over time. However, other research indicates that moderate caffeine consumption, around 300 mg per day or about 2-3 cups of coffee, doesn't significantly impact calcium levels or bone health in most people. It's important to note that individual responses to caffeine can vary, and factors such as age, gender, and overall diet can influence how caffeine affects bone health. If you're concerned about your caffeine intake, especially in relation to bone health, consider discussing it with a healthcare professional who can provide personalized advice based on your specific situation. In point number 5, we will talk about beans may prevent your body from absorbing calcium. Pinto beans, navy beans, and peas are high in substances called phytates. Phytates can interfere with the body's ability to absorb the calcium that's also found in the beans. Because beans are rich in magnesium, fiber, and other nutrients, making them otherwise good for osteoporosis prevention and your health overall, you needn't avoid them altogether. In point number 6, we have inflammatory foods. Inflammatory foods can potentially worsen bone health by promoting inflammation, which can lead to bone loss. Foods high in sugar, refined carbohydrates, and saturated fats are generally considered inflammatory and may negatively impact bone health. Additionally, excessive alcohol consumption and high intake of caffeine can also have negative effects on bone health by interfering with calcium absorption or increasing calcium excretion. It's important to note that while these foods may contribute to inflammation and potentially impact bone health, the overall diet and lifestyle factors play a significant role as well. A balanced diet rich in calcium, vitamin D, magnesium, and other nutrients essential for bone health, along with regular physical activity, are key components of maintaining healthy bones. In point number 7, we have raw spinach and Swiss chard. Both raw spinach and Swiss chard are good sources of nutrients important for bone health, such as calcium, magnesium, and vitamin K. However, they also contain oxalic acid, which can interfere with calcium absorption. Cooking these greens can help reduce the oxalic acid content and make the calcium more bioavailable. Additionally, it's important to consume a variety of foods rich in these nutrients for overall bone health. In point number 8, we have red meat. Red meat can be a good source of nutrients that are important for bone health, such as protein, iron, zinc, and vitamin B12. Protein is essential for building and repairing bone tissue, while iron and zinc are involved in bone formation and maintenance. Vitamin B12 is important for bone metabolism and helps prevent osteoporosis. However, it's also important to consume red meat in moderation and to choose lean cuts to minimize saturated fat intake, which can have negative effects on bone health and overall health. Incorporating a variety of foods rich in these nutrients, along with a balanced diet and regular physical activity, can help support bone health. In last point, we will talk about alcohol's impact on bone health is a bit complex. Moderate alcohol consumption, particularly of certain types of alcohol like red wine, has been associated with some health benefits, including a potential positive effect on bone mineral density, BMD. However, excessive alcohol consumption can have detrimental effects on bone health. Here's a bit more detail. 1. Moderate alcohol consumption. Some studies suggest that moderate alcohol intake, especially in postmenopausal women, might have a protective effect on bone health. Red wine, in particular, contains polyphenols like resveratrol, which may have bone protective properties. However, the evidence is not conclusive, and the exact mechanisms are still not fully understood. 2. Excessive alcohol consumption. Chronic heavy drinking, on the other hand, can lead to decreased bone density, increased risk of fractures, and other bone-related issues. Alcohol can interfere with the balance of calcium, vitamin D, and other minerals important for bone health. It can also affect hormone levels, which play a role in maintaining bone density. 3. Overall recommendations. If you choose to consume alcohol, it's best to do so in moderation. Moderate alcohol consumption is generally defined as up to 1 drink per day for women and up to 2 drinks per day for men. It's also important to consider other factors like overall diet, physical activity, and lifestyle choices, as they all play a role in bone health. 4. Individual factors. It's important to note that individual responses to alcohol can vary based on factors like age, sex, genetics, and overall health. If you have concerns about alcohol and its effects on your bone health, it's a good idea to speak with a healthcare provider or a nutritionist for personalized advice. Subscribe for more videos.